just going to start the process of telling you a little bit about Open Innovation in Action at Stevenage, and to hand over to Chris in 1 second, and hope that he takes a short amount of time to tell you about the activity that he and colleagues Katie and Martin have been doing around the Stevenage Bioscience Catalyst as a model for businesses' engagement and focus on science. I'm then going to come back and tell you about Claire O'Neill's work around the audit, what we found, what we need to do better, explain how we're just starting a case award with Sabrina at the University of Manchester, and then tell you where we're heading on the Future Health campus. So here's where it goes pear-shaped now. And I'll hand over to Chris Ford, good friend, good colleague, who's going to tell you about the Lancaster University work.
So that's a flattering introduction, isn't it? This is where it goes pear-shaped. So straight away, I'll get this bit over with. I'm Chris Ford and I'm an accountant. I've been coming back and forward to Sbc for about 5 years now, doing different parts of research. And in a sense, the work I've been doing here is very different from the previous session, which is lots of detail and information for you about what you're practically doing. It's trying to take a step back and look at these innovation or open innovation ecosystems and looking at them from a performance management perspective. What makes these whole systems work? What drives performance across the systems? And the big chunk of work looks at different industries, trying to get insights that cut across industries. And Martino's asked me to share some of the things we've been looking at Sbc and what makes Sbc successful with you today in a short session in the middle of his bit, where he's going to then get into more detail about the metrics and the performance. So the work that I do is performance management and management control. And although I'm an accountant, the work is really about stepping back from numbers and metrics and saying, what are all the different things that we try to control to make something as complex as Sbc a success? So things like culture, things like architecture, as well as financial and reputational factors. And of course, having come to Sbc from very early on in its formative stages, we could see this combination of loose and tight controls. Really, the great example of this is the missionary that goes off on a boat to some dark continent to do their work. And you might say, well, there are no real controls in place. But of course, the process of enculturation and indoctrination and training and the tight alignment of their goals to the goals of their church, those are the controls that are in place when they start their work wherever they are. And I think this notion of the religious zealot with Martino and his view of open innovation and his passion for it are useful similes, in that what we saw here is this really tight control of a few really key things, really tight alignment of vision. And I talked a lot with Martino several years ago about this idea that the tenants have to get it. Everyone has to get it. He wants people who understand and buy into the vision of open innovation at Sbc. But then a really small number of metrics being used, and in particular this tight focus on IP generating tenants, so keeping this 75% figure and making sure that people are coming here to deliver really high quality science. And also another catchphrase you'll have heard from Martino probably is, open innovation is a contact sport. But we look at the whole of the environment here and the importance of architecture and the design of space as part of an overall system of controls and management systems that help to make open innovation happen and drive the innovation. But what this means is we can be really loose about other forms of control to allow real entrepreneurialism, and entrepreneurialism in the way Sbc is managed and run. But this only goes so far in the life cycle of an organisation. And of course, there are big aspirations for growth of Sbc and growth of the campus. And my work is really about saying, well, do we need to worry about trying to understand these systems? Do we need to take this step back view? Or can we just be happy that there's a great entrepreneur in place making everything work? And we would argue that, yes, we need validation for external people. We also need, as this whole system grows, a greater sense of how do we conceptualise what is driving success here so we can share that internally with new managers, next generations of managers across the site and also across industries. Now, we talked a lot about goals early on when I was here visiting Martino, and a reasonably sensible view might be that an incubator is based on generating some rents and kind of place-based goals. But this is roundly rejected by Sbc. And of course the reason is, in a sense, because Sbc, it's not a noun, it's a verb. Sbc is not an incubator, it's a place that provides incubation as a process. And it's this idea that it's not a static place, it's a place where lots of things happen. You don't come here and you rest. You come here and you go through a really highly engaged, driven process of incubation. But the goals extend beyond developing a really powerful process to looking at the outcomes of that process and the development of an ecosystem. So we have these three interlocking views of what the goal is for Sbc, and it has to succeed on all of these levels in the long term. And with these different timescales come different perspectives on funding, on governance, and on metrics, which is the area that I've then become more focused on. And of course we have to see the key stakeholders having this longer term view of funding, and in particular governance. And you can replace that word governance with effort. The effort that is put in to Sbc by these original key stakeholders, the GSKs and the Wellcome Trusts, is so important. And this, for me, has been really interesting as a real exemplar of best practice in governance in what was effectively a startup. And Sbc was a startup. There isn't this arm's length governance. There isn't even just involvement in the board, but there's this, and I think we've heard about this idea of champions, and you can see the fact that for Sbc, the people here from GSK and from Wellcome were champions from their own organisation, driving these relationships through a really engaged form of governance. But the big challenge is metrics, because if we want to help to explain what Sbc does, particularly with the convergence agenda, there are going to be more stakeholders, perhaps having had less engagement with Sbc in its early days. So we need better ways of explaining what Sbc does, why it's successful, how it measures its success. So we're really interested in this process. What is it that makes this complex process work? How do we somehow distill it down to some key ideas? And for this, we want to get into the business model. What is this business model of Sbc that brings all these things together? And this was interesting for me because the start point of most business model theories is that they're focused on one key unit of measurement, which is the pound, the dollar. Ultimately, it's about how you create and capture and distribute value. But Sbc wasn't set up to make a profit. So what is the key notional piece of value? And that piece of value is scientific value. Sbc is about advancing science. So we have to start business modelling essentially from scratch and say we're not going to use the traditional models. We need something that is absolutely centred on the advancement of science with Sbc. So we came up with this idea of a science-centred business model for Sbc. And essentially Sbc acts as this temporary wrapper because it is a process. Science is embedded in different organisations, in different places, and Sbc has to go and find this and help it to move here. And these temporary wrappers, they hold and they protect the science, these organisations, but ultimately what Sbc is trying to do is increase this flow of good science to grow this ecosystem. And of course that means there's incubation. And this incubation has two phases. There is this scientific phase, but then there is also the business incubation, as we've talked about in this previous session, helping these businesses, because the businesses need the funds to advance the science, and also they need the rewards as the baton holders of this advancing technology. So if we're trying to systematise and map this out to think about how do we create metrics, how do we prove the value of SBC, we can see really clear actions going on in each of these phases. Locating the science, helping the relocation. And this is a really important activity that Sbc excels at, is helping people to understand their offering and helping them to successfully relocate into the incubator space and then develop an exit. But of course, the other interesting thing that we see in events like this and many others is this focus on multiple iterations. This business model has to iterate because they have to learn, because as we've heard many times, the environment is changing and Sbc wants to keep getting better. Now, within this model, I haven't talked specifically about open innovation yet, or open innovation in action, which is the title of the presentation. And in a sense, it's because open innovation is embedded in everything. Sbc doesn't do open innovation, it is open innovation, it's deeply embedded. But I know one of the challenges, and I think Martino will touch on it in the next part of his presentation, one of the real challenges is how do you actually prove that you're doing good open innovation? How do you measure the success of it? How do you validate it externally? And also when you're handing on your managerial baton to other people as your organisation grows, how do you explain to them what are these bits of open innovation we do? So we pushed together some different theories to try and come up with something a bit more practical that would help. And the first obvious thing is what we call bridging open innovation. This is about growth. This is seeking the partners to help augment the offering, seeking the tenants. So it's about growth and service enhancement. To some people, that's all open innovation is. It's that external facing thing. But of course, we know that as well as bridging, there's a really important bonding role that takes place, which is making increasingly dense networks of ties amongst the different stakeholders that are already in some way connected to Sbc. In the interviews we've carried out as we've been coming here, we've heard about, for example, groups that have worked together to improve their ability to succeed when applying for grants. And the learning that takes place in these communities is so vital. And of course, that really focuses on improving the performance of people already in the network. But it has a powerful bridging effect because people looking in are looking at how effective Sbc is at these bonding activities, at supporting them. And that's what makes Sbc this incubator of choice. And then finally, and this is the last click on my last slide, so I think I'm in good time for Martino, is the shaping activities. And this has been a really significant role for Sbc, which is shaping culture of the organisations within and around. But also, it's the combination of these factors, the loose and tight controls put together, the highly engaged governance, that has allowed Sbc to be a test bed for innovative ways of working, innovative ways of shaping its business model. And essentially it's become, I think, a real exemplar of open innovation activities. And what Sbc is effectively a proof of concept, either for second movers in bioscience, but also for other industries. You'll have seen on my very first slide, I showed a telecoms collaboration, huge global collaboration amongst the world's 14 biggest telecoms operators, Intel and Hewlett-Packard. They cite open innovation as the real driving force for complete disruption of their supply chain. They haven't created any markets yet that they want to create. Where are the exemplars going to be? Where are the new hubs going to be for telecoms? Who are they going to be looking at? And I think Stevenage is a great example for them, for different industries. So the work that we do is ongoing. It's obviously very tiring. When I started, I had way more hair. We're here today, Martin and Kate are here with me. We'd love to talk to you more about this. These are ideas. We're interested to hear your ideas or your challenges to our ideas. But thank you very much for your time, and I will now hand over to Martino.
Thank you, Chris. And that really is an explanation for those that have been around me for the last 4.5 years of why I've never stopped to give anyone that's asked me a definition of what open innovation is. You just get on and do it. And back to the original panel discussion, it's all about appetite to engage. Okay, so I just want to move on now to some of the findings that Claire O'Neill's annual audit around open innovation, engaging with our tenants, stakeholders, partners, experts. What did she find? And the reason that we use external auditors is because we usually find if we try and do it, we get the answer that we expect, or that the answer that our tenants want us to hear or think they want us to hear. So this is far more productive in getting some learning lessons. And the key message that keeps coming back is that the proximity and the engagement with GSK is the most valuable, unique selling point of our offering. And we embrace it, and it's great, and we want to do more of it. And we've managed to keep above that threshold of 75% IP and research intensive. We're not against CROs and services, as Richard will tell you. We want them to engage through the virtual network as well. And the fact that 50% of the tenants are currently engaged in new activity and new idea generation that wouldn't have happened had they not been here is amazing. So that timeline on your left here just shows you the increase in the numbers of tenants and projects and activities. The breakdown on the right shows you the level and the types of companies. It's quite interesting, and to warn you, when you're back in this room next year, the 2016 number won't have gone up much, but actually we'll be putting down things like there have been exits, there have been graduations, and I think people have heard me say it before, there have been failures. And again, we embrace it. It happens. It's part of what we do, and it's why we're here. Okay, the other thing that we embrace, and the thing that is part of our core business, and I want you to remember this when I come and talk about future healthcare campus, we are predominantly here for therapeutic businesses. They may not all be small molecule companies anymore. There may be a whole range of little antibody cluster type companies, different antibody platforms, and some new burgeoning ones in cell and gene therapy. But this is our core business. We have some device and diagnostics. We hope that will grow. That logo on the right is actually Syme Diagnostic, who are going gangbusters at the moment in terms of investment and funding, and the device is developing really well. Interesting manufacturing, advanced manufacturing. We've embraced the fact that advanced manufacturing is open and right for open innovation and for collaboration and partnering. Why wouldn't they be here? Puritify have got lots of activity going on directly with GSK. Not so many big data analytics companies yet. We're still defining and refining who we are and what we do in that space, but the occasional company is still coming through. And we have no problem with service and consultancy companies being part of our virtual tenancy and part of our network. And the logo on the right is Protavio, and you'll hear them in a short while. They're one of our most recent tenants. And as Emma stole my thunder earlier on, we're absolutely delighted to announce that Sanofi have opened a partnering office alongside Lily being here and J&J and my good friends from GE as well. This is the one that is really important. There's over £100 million of VC and grant funding in the tenants. It's all about the tenants. And there's a whole range of investors that are investing. And it's wonderful to see Imperial Innovations with 4 spin-outs with investment here, SR1 with 2, UCLB, and a whole range of different ones. And my good friend Louis is in the audience and brought one of the very first invested companies to Sbc. Okay. So success looks a bit like this. And remember what Chris was saying to you about having to define these new metrics, but we still have to talk in a language where people box you as an incubator. How many jobs have you created? Over 200. How many sales? No sales, they're biotech companies. They all have investment. We have over £100 million worth of investment in the companies. And the really interesting thing for those UKTI government people in the audience, tenants from Japan, US, Australia, Belgium, and now Greece. What's going on? What's that about? But it's good. Open innovation, I wanted to be risky and put 4 because this is the 4th, but let's assume there's a 4th successful Open Innovation Summit. And it's about us telling you who we are, what we do, and how, hopefully, we can get better. And that whole measurement and metrics, but don't get hung up in it, but don't take our word for it. Get other people like Claire and Chris and Katie and others to come and share with you what they think should be the metrics for success. But in the meantime, get on with it and do it. And Claire put this slide together with me about 5 years ago, and it's still about connectivity, collaboration, and challenge. And embrace the fact that you've got a mothership who wants to engage with the partnering and the collaboration with companies. Okay, but we do learn, and there are learning points that are coming through. As I said, Sinovo have opened the doors and want to do more engagement directly with GSK. They've been brilliant, and our tenants are asking for it more and more. And hopefully more and more examples and case studies of access to technology, access to platforms, access to compounds, all of those that are happening right now will happen more and more. We haven't made the best use of our experts panel. For those of you on our experts panel in the audience, I apologise. We will do better. And that came out from the audit that Claire developed for us. The academic hub idea is to open our doors to all of the universities, and you'll see a little bit more about that. And Discover Assist has been usually successful, and we want to do more of it. Barbara's not here, but the one big thing that came through from Claire's summary was, please bring back the entrepreneur in residence role. She was amazing. I'm not sure if it's the role of Barbara, but we need to do something again in that space. And we do, for our stakeholders, for our investors, we need to keep measuring ourselves in a way that is easier to communicate. And the last one is a really important point for me. We need to do better at communicating the vision and the strategy and what we do well. It's not easy. Okay, so welcome to the campus. You're in that orange logo bit, just to get your bearings, and this is the campus as it develops. The incubator building that you'll go over to is where we are based. We have GE in there. The MRCT arrived, hi Mike, recently, and we're delighted to have them, and we've got a tenant on the ground floor coming soon. The animation is a vision of what phase 2 will look like, more of that later. And Keith is here, and we are delighted to have the cell therapy catapult coming in our direction. Wow, is that a big building? Okay, and there's room for more. This will be a world-class open innovation biomedical campus. I have no doubts. But it's not been, and this has been the challenging thing about communicating, it's not just about what we do physically in Stevenage. Incubation is a process. It's not about just the physical labs and offices that we offer. We offer access to expertise, early academic industrial engagement so that failure happens when it should do, and you pick the winners and ride with them as quickly as possible is absolutely crucial. And Discover Assist, Bill Dawson, Chris Riley, myself, working with Nuno, who's here, and academic projects to say, stop, don't do that. We did that 10 years ago. I can't tell you how often that happens, unfortunately. But the holy grail is to find a pharma or a GE that says, wow, that's amazing. Can we help you move that forwards? So that's a really important part of the service. We're now engaged with over 17 universities. Centres of excellence include the Sangha, wanting to work and soon working, hopefully, with the CRIC, the National Physics Lab. Somebody said it earlier, silos, but what happens in the cracks between the silos is where the innovation comes from. So National Physics Lab could be a huge source of innovation for us. And it's how we get and extract the value out of that. So lots of meetings, lots of reports with rigorous feedback early to say stop or proceed or how can we get you to your money. And a lot of it around getting people like Roy and Sinovo and Malcolm within GSK to give us an early engagement, because very often for these projects it's a bit of a minefield. It's complicated to get in. So Nuno and I have been working on this slide for quite a while. We think we're creating a funnel. Everybody has a funnel. Where does our deal flow come from? Well, 2 years ago through Discover Assist, a lot of the funnel activity came from universities. But you know what? We started to approach charities. The KTNs are starting to bring projects. We have a wonderful relationship with the non-animal testing people who are finding that even after they invest in projects, those projects are still not close enough to commercialisation. And Sbc is right in that sweet spot to be able to help to deliver that. The Academic Health Science Centres, where's Linda? Hi, Linda. Really important that not just on your doorstep do you engage and work with the NHS. And we are working on a process that will hopefully help with more engagement and interaction. The Academic Hub builds on what we've already had here through Christine and Marianne, UCL and Cambridge, actually physically here, with a number of projects, not all staying for long periods of time, moving through, engaging with pharma and moving on. What we want to do now, and what we've agreed with Marianne and Christine, is to work on a model that now allows space within an academic hub to be made available through a hotel model for other university projects. So they don't have to sign 3-year leases, but they can come in and go a little bit easier, get the development work done, fail early, or move on. And I'm really grateful to UCL and Cambridge for embracing that model. More of that next year, hopefully. Ian's in the audience. He might say more about this. You've already heard about the Apollo Therapeutics. It's really important that funding is associated with the development and the future development of the ecosystem. It's about people, it's about infrastructure, but it certainly is about money. And if you don't have one of those key elements, and certainly if you don't have access to the money, you're going to upset a lot of people. So keeping that ecosystem going through that is really important. Sabrina, where's Sabrina? Hi, Sabrina. So we've just got a case award with the University of Manchester, my former colleagues at the business school, to carry on that prodding and poking around what are you doing, Sbc? How are you doing it? What are the challenges? What are the metrics? And Sabrina's starting a project, and she'll be on the stage in a year's time, telling you where she's got to on how does IP influence open innovation. I don't have time. We're doing it. So it's really nice to have people collaborating within that academic space to say, have you thought about doing this? And that's where the value is. Okay, so Claire, you're next. We have been working with Claire Thompson in a consultancy basis to look at the future and phase 2. And we started some of the conversation around convergence. I think, like Chris said, probably confused a lot of people, made it overly complicated. But the point was, healthcare's changing. Those therapeutic companies are going to look slightly different in 5-10 years' time. They may have a bit more IT, electronics, and engineering components, and therefore the IP landscape's changing. So how does Sbc, with its future campus development, get ready and prepare for that kind of space? This is a slide that Miranda put together that started originally with convergences bringing IT, electronics, and engineering together. I think it's a lot more refined. It's certainly got a time base that says, you know what, with the cell therapy catapult, GSK with the regenerative medicine group, GE, we've got the Tokyo Electron guys working in this space, we've got Plasticell Progenitor. It's already happening whether we like it or not. We're likely, with the catapult being here, and it's already happening, we're likely to be a magnet for more cell and gene therapy. So whether we like it or not, we're in that space. And that is part of the future of the healthcare campus. How lucky are we to have people like Roy? Roy, you're next. That is part of GSK and part of a developing group in the bioelectronics space. Wow. Potentially disruptive, potentially impactful, but the sort of thing that incubators and incubation and academic projects should be starting to engage with. So how can we develop an incubation process that works closely with Roy and Chris Pham and others in GSK to develop startups and projects for investment and development with that early academic engagement. So we're in a unique position, and we should be taking advantage of it. So regenerative medicine first, bioelectronics next, precision medicine, we're back where we were with open innovations, people still defining it. We don't know where we should be in that, but we know we will be. And we know that we'll all be talking about digital health in 5 years' time as being part of the norm. Okay, and a lot of the key opinion leaders that Claire talked to about what we should do, what we shouldn't do, all mentioned incubation, 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 and incubation. So what a great opportunity for SBC. Funding always comes up, but it's all about developing new ecosystems, right? And regenerative medicine is already starting. Routes to market, routes to commercialization need further development, but we're in there. Bioelectronics, whole new market, uncertainty, but we need to start developing the next projects, the next generation of startups, and bring money to it. And these are potentially further downstream. So, phase 2 for SBC. Don't forget those therapeutic companies that I mentioned on one of my earliest slides. They are our lifeblood, and we will never go away from attracting those companies, whether they be small molecules, biologicals, or cell and gene therapy. This is an opportunity to wrap around it more regenerative medicine, an opportunity that is new and unique in bioelectronics, and to follow the story of what may or may not happen in precision medicine and digital health. But there's our USP, folks. It's about that proximity. It's that global reach that I can now validate. We have Greece, we have Belgium, we have, it works. And the business model. And the business model works for me when I validate it through colleagues like Chris and Katie and Sabrina, so you don't have to take our word for it. And it's never, ever been about me. I have a wonderful team. And some of the executive team, including Amanda. Amanda, are you here? Amanda Kitely-Pugh just recently got promoted to our executive team. And those 4, Colin, Miranda, different looking Miranda, Dave as our building manager, and Amanda, they're the ones driving this now. I just sit back and take all the glory. And with that in mind, when you clap, please remember I take all the glory. Thank you.